Good day, folks. Thank you for joining us here at Your Health. On today's program, we will be taking your calls and answering your questions the entire hour. Please get on the phone. I'd love to talk to you. But first, let's go to our news. Let's see what's happening in the health world. Women that sunbathe live longer than those who avoid the sun. Researchers from Sweden followed almost 30,000 women's health and lifestyle practices for 20 years. In addition to finding sunbathers live longer, they discovered avoiding the sun increased death risk about as much as smoking throughout adulthood. The researchers comment guidelines restricting sun exposure may be doing more harm than good. The study was published by the Journal of Internal Medicine. Well, folks, can you believe this? We're witnessing a paradigm shift. The internal medicine experts state the long-held advice to avoid the sun may be doing more harm than good. Do you think, really? A few years ago, Finnish researchers stated if we doubled our sun exposure, we would save 10 times the number of lives lost to skin cancer. And this current study backs that statement with like findings. The experts state the study does not prove the health and longevity promoting effect of sun exposure is due solely to the sun's vitamin D making ability. In fact, sun exposure creates some 20 or more physiologic actions that benefit us, and vitamin D production is just one of those things. It is interesting to note that the vast majority of cutting-edge vitamin D research comes from far northern countries where sunlight is a more limited and appreciated seasonal event. It's also important to note that ingesting a diet rich in plant antioxidants dramatically reduces your risk of skin cancer secondary to sun exposure. So, bottom line, eat your 5 to 7 fruits and vegetable servings daily, enjoy limited sun exposure as we should never allow ourselves to sunburn, and take your daily vitamin D with dosages guided by blood levels. Women are not being advised they're at risk for heart disease. Researchers from the American College of Cardiology surveyed over 1,000 women about their health and their experiences at doctors' offices. They found 75% of the women had at least one major risk factor for heart disease, yet only 16% were told by their doctors that those life characteristics were putting them at risk of heart attack. When women were advised of having an increased risk of heart disease, the most common advice was to lose weight. Related research from Oregon State University published in Mayo Clinic Proceedings finds only 3% of all Americans achieve all 4 essential components of a healthy lifestyle. The study evaluated health parameters of over 4,700 Americans involved in the National Health and Nutrition Survey. Well, folks, this is truly discouraging. 3 out of 4 women have elevated risk for heart attack, yet when they go to the doctor, only 16%, or about 1 in 5, are told of this risk. And when they are told, they're usually only told to lose weight. You see, obesity is not a major risk factor for heart attack. The major risk factors for heart disease are smoking, diabetes, hypertension, sedentary lifestyle, elevated cholesterol level, and increased total body inflammation. This study was quick to report. Being told to do something that we know intuitively will not help only stigmatizes women, which in turn keeps them from visiting the doctor. Well, who wants to be told to lose weight anyway? It is important to be objective, so in defense of doctors. They don't have the time, nor are they paid to teach us how to live a healthy life. Their job is the treatment and diagnosis of serious disease. It is yours to find out, and my job to teach lifestyle practices. In fact, that is why this program is being aired to you today, to help you, educate you in the ways of wellness. So what are those 4 essential components of a healthy lifestyle that only 3% of all Americans achieve? A healthy diet, regular exercise, maintaining a healthy weight, and not smoking. You do these things, and you won't need to see a doctor very often. Vegans may not be getting enough nutrients. Researchers from Finland compared the diets of 22 vegans with 19 non-vegans. They found many of the vegans ingested suboptimal nutrition. The typical vegan showed incomplete protein intake along with low intakes of berries, fruits, nuts, and they often failed to include fortified foods in their diet. The vegans also showed low levels of the following nutrients in their bloodstream: beta-carotene, selenium, iodine, and essential fatty acids. The vegans in the study were, however, good at supplementing their diet with vitamin B12 and vitamin D. Well, folks, the first thing I must say is this study was conducted in Finland on Finnish vegans, so we must take it with a grain of salt. However, I think the study's essence holds true here in America, and thus worth the effort. Vegans, it's important that you know how to combine foods so that you attain complete protein in every meal. Grains, when combined with legumes, provide complete protein. Plus, soybeans and quinoa provide complete protein. There are a few other rich sources of protein. For example, corn and tomato, when eaten together, provide complete protein. Adding nuts to dishes helps to assure complete protein. Attaining complete protein can be difficult, so many vegans supplement their diet with protein supplements. Also, vegans, you are urged to add more berries, fruits, and vitamin-fortified food products to your diet. You're doing better with B12 and vitamin D, but your beta-carotene, selenium, iodine, and essential fatty acid blood levels may be low. I hope you find this helpful, vegans. Well, today in Your Health, we will be taking your calls. Stay tuned. We'll be right back.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with GastroDefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford. Order online at bioinnovations.net or call 888-442-1828 and ask about the AutoShip program for additional savings. I'm Cindy Becker, and this is Your Health at a Glance. Are you following a low-fat diet? While it's true that too much fat makes us overweight, certain types of fat are actually good for us. Add to your diet omega-3 fats such as fish and flaxseed oil, and omega-9 oleic acid found in olive oil. And reduce in your diet omega-6 found in corn, safflower, and peanut oil, and saturated fats found in meats and whole milk dairy products. Studies show those fats can promote inflammation and chronic disease. The Mediterranean diet can help you make good choices, such as fruits, vegetables, whole grains, lean meats, fish, olives, and olive oil. So remember, increase omega-3 and omega-9 fats. Reduce omega-6 and saturated fat. For Your Health at a Glance, I'm Cindy Becker.
Do you believe that nature holds the answer to your health needs? Are you looking for a supplement that's simple and pure, yet really works?
If you're looking for nature's answer to better health, look to Aloha Noni Juice. It's pure and fresh, just like nature intended. Aloha Noni Juice is brought to you direct from the islands of Polynesia.
Aloha Noni Juice is 100% pure with no added sugar or sweet fruit fillers. It's the perfect addition to your low-sugar diet.
Aloha Noni Juice drinkers will tell you their vitality, energy, and sense of well-being have improved, along with relief from many painful conditions. Made by nature, proven by science, Aloha Noni Juice contains only nature's best.
And now you can enjoy the benefits of our new 100% certified organic Noni Juice. Order online or call 888-442-1828 and let BioInnovations assist you in making the right choices to better health. Ask about the AutoShip program for additional savings. Welcome back, everyone. It's great to be with you today. Well, today's show is all about you. We want to take calls the entire hour today. We want to talk to as many people as we can. So please pick up that phone, dial the number. We're here standing by. Well, let's start by going to Missouri and welcoming Amber to the show. Hi, Amber.
Hi, how are you?
Great.
We're good. How are you doing, Amber?
I'm doing pretty good.
Uh-huh. How can we help you?
I am a mother of 2 young children. I'm 34.
Okay.
And I started having chronic fatigue about 9 years ago, and within the last 2 years, I've been diagnosed with rheumatoid arthritis.
Okay.
I've been watching your show, and I've been taking lots of information down, and I've implemented a lot of things, but I haven't heard a straightforward plan to help with the pain management of rheumatoid arthritis.
Well, a straightforward plan is, you know, one recipe does not work for everyone. So you've had the fatigue for 9 years?
Yes,
Yes?
I started with chronic fatigue. Yes.
Did you have a life event, a very traumatic life event, or just everything was going fine and you just started getting fatigue, or was there an event, like a car accident, an operation, a divorce, something like that? Anything?
Actually, it happened after the birth of my first daughter, who's
Okay.
now older. She's in school age, and now I have 2 other young children.
Okay. Are you taking any dietary supplements? Tell me what you're taking.
Okay, well, I have had great improvement since I've been taking the following. It's kind of, like I said, a whole regimen. I take 2 pharmaceuticals, low-dose naltrexone at a 4.5 milligram,
Yes.
hydroxychloroquine.
Yes.
I take 1,600 units of vitamin D a day.
1,600?
Yes.
Okay.
I take 1,000 milligrams of turmeric.
Okay.
I take ginger 3 times a day or as needed for pain, as I don't do over-the-counter pain medication.
Right.
And that's at 550 milligrams. I do Epsom salt baths typically is how I'm getting my Epsom salts. I do take a daily whole food vitamin and probiotics, and I started taking the reishi recently from one of your shows, the medicinal mushrooms.
Yes.
I've been taking that, and over the last 2 weeks, I've had great improvement in my pain.
Okay. Amber,
yeah.
how did they diagnose your rheumatoid arthritis? Because how we have diagnosed that disease traditionally is you have multiple characteristics, and if you have 5 or more of those characteristics, we put you in the category of rheumatoid. So there's not one test that triggers positive, and everybody who does that is rheumatoid. It's kind of a vague diagnosis. How did they diagnose you?
Well, I've been diagnosed twice. I was the one who said, I want you to run this test because my mother and my grandmother both have rheumatoid arthritis.
Okay, so
and
there's
I
family
recognize
history.
the symptoms.
Uh-huh.
Yes.
Okay. Do you have trouble with allergies, Amber?
No, when I was younger I did, but I kind of grew out
you
of that.
did. You do have troubles with allergies. Any history of allergies is relevant. You know, in allergies, your immune system is inappropriately reacting to an agent that will not harm you, like ragweed pollen. Rheumatoid arthritis is a condition where your immune system inappropriately reacts to something that will not harm you, your synovial linings. There's a similarity there, isn't there?
Yes, there is.
Yes, there is. Now, they're different biochemical reactions. I admit that. But the propensity to react inappropriately is common to both conditions. That is why I'll never forget when I first found out about this, a patient told me, you know, I was diagnosed with rheumatoid arthritis, and then I had a chocolate bar one day, and my arthritis was so bad I couldn't stand it. I was really in agony. And since I do not eat chocolate anymore, I no longer have rheumatoid arthritis. And I just said, you're kidding me, really? He says, yeah, I can prove it to you, but don't ask me to do it because it hurts. So I got to thinking about that. It can be a reaction to any kind of food. Any kind of food can tune up the immune system to start to react inappropriately. It's a cross reaction. What do you think of that notion? Think of that for a minute. What do you think of that?
I think it's possible. When I went gluten-free, I felt a significant improvement in my symptoms.
Amber, we're on to something. So you intuitively thought about the same thing. You said, boy, what if I start to eliminate, say, wheat? Because this gluten thing, I hear about it all over the place. And it helped. Well, is it possible maybe there's something else? Think about it for a minute. It could. How do we figure that out? Well, there's two basic ways. You do a blood test that tests antigens to a variety of foods to your bloodstream, and we see if there's antibodies there. It costs more. You got to send blood off to a special lab. You have to have the cooperation of your doctor, who may not believe in that test. They may not believe in it at all. I've seen that more than, yeah, I'll do it. Or you can do an elimination diet. The laboratory that I am fond of is Cyrex Labs, C-Y-R-E-X, Cyrex Labs in Arizona. They do a great job of this. They're pioneers in this field, and that's where you would send it. You can call them and ask them about how to do all this, and they'll help you with it. But I really want you to think in terms of, I'm reacting to something. See, it makes no sense to me to go through life taking immune suppressant drugs, and you're not necessarily doing this. There's a drug out there now, I think they call it Humira. It's used for rheumatoid arthritis. And these drugs have their place, folks. But it should never be the first thing you go to, because it indiscriminately suppresses the immune system. And people do get help with rheumatoid arthritis, but it opens the door to massive infections. Overwhelming, life-threatening infections. And so you really have to balance these powerful drugs they have today with the side effects. And if you watch television, you're familiar. Am I right, folks? They spend more time revealing the side effects of these drugs than the benefit. And they do it with a smile, as though that just wipes out the potential for death side effect from these drugs. So there's a place and a time for all of these medicines, but why would we want to go to that first when perhaps we're doing something that is initiating an immune reaction? What about the possibility of heavy metals? There are mines in Missouri. There's a lot of mines in Missouri. One of the largest lead deposits in the world is in Missouri. Maybe you live in a town close to that. Maybe family members, you know, you said it runs in my family, it's genetic. How do you know the whole family's not exposed to some heavy metal? See, this happens more than the family history stuff. Everyone's exposed to the same poisons. Think about those things. Heavy metals, things that poison our mitochondria. Things that poison our mitochondria lead to fatigue and abnormal immune responses. So here's things you need to think about. You need way more than 1,600 vitamin D. You need your blood level to be around 70 nanograms per deciliter of vitamin D, and that's going to require between 7,000 and 8,000 units a day. But you have to go by your blood level. The GLA, the essential fatty acid GLA, fish oil, these calm inflammation. Curcumin, you're on it, but keep taking it. Magnesium. The medicinal mushrooms, girl, you hit it right on. It's amazing. They're as powerful in calming inflammation as steroids, but without the steroids. That's the beauty of these medicinal mushrooms. Treat the dysbiosis. Find out if you're reacting to a food. And nourish your mitochondria, because through the mitochondria in the cell is how you fuel healing. You feel healing through the mitochondria. CoQ10, L-carnitine, D-ribose, magnesium, and then the final categorical treatment approach is treat dysbiosis. I know you have yeast and abnormal bacteria in your intestinal tract. Oil of oregano, probiotics. I want to send you Foundations for Healing. There's a whole chapter on autoimmune diseases, and it'll give you a guide to how to supplement, and you do your part. Are we communicating, Amber?
We are. I'm hoping not to take those drugs that you were talking about,
well,
and that's why I'm willing
I hope you don't have to. There's a time and place for everything, but let's do due diligence, do all that we can, and get this into remission, because rheumatoid is highly destructive. I'm sorry we have to leave you now, Amber. Good luck with you, and your care package is coming. We have a break. We'll be back. Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all four in one convenient package we call the Fruits of the World 4-Pack. And remember, it's 50% off by the case. Give us a call at 888-442-1828 or go online at bioinnovations.net.
I'm Dr. Richard Becker for Your Health at a Glance. Are you looking for a way to lower your risk of Alzheimer's? As the prevalence of obesity and metabolic syndrome continue to increase, researchers have found a possible link between type 2 diabetes and the onset of Alzheimer's disease. In fact, type 2 diabetics are at 200% higher risk of Alzheimer's compared to people without diabetes. These metabolic changes that develop with diabetes appears to greatly increase the speed of deterioration of the brain and other related systems. Lowering your blood glucose is easier than you may think. Eat smaller meals, exercise regularly, and reduce carbohydrates in your diet, especially simple sugars. Taking steps today to control your blood glucose may protect your entire body, including your brain. For Your Health at a Glance, I'm Dr. Richard Becker. There are thousands of fungal species, and at least 200 of them have been found to cause human diseases.
Fungal infections are common, so what can we do to protect ourselves?
One solution is oregano, a natural alternative. Oregano fights problems created by fungus and yeast overgrowth, and it improves many other health conditions.
At BioInnovations, we offer oregano in gel caps and liquid extract.
Yeast and fungal disorders can improve.
So take charge of your health by choosing a natural alternative such as oregano gel caps or oil of oregano liquid extract. Give us a call at 888-442-1828 or go online at bioinnovations.net. Check out our AutoShip program for additional savings. We're back, everyone. Let's go to Pennsylvania now and welcome Lorraine to the show. Hi, Lorraine.
Hi, how are you?
Hey,
Great.
We're doing pretty good. How about you, Lorraine?
Well, I'm okay. I could be doing better.
Okay.
In September, I was diagnosed with osteoporosis.
Okay.
And the doctor had put me on, I've been taking the Fosamax now. It's almost 2 months I've been taking it. I really was reluctant to take it, so then I decided to take it because the doctor said you might break a bone, you're at the gym. So I'm taking it now, but he wanted me also to take Caltrate with the D3 in it.
Yes.
But I can't take that because I have a history of kidney stones.
Oh, really?
Yeah, I can't take that.
So you're saying you can't take calcium because you're afraid it'll cause a kidney stone.
Yeah,
that's been disproven, Lorraine. That's not true.
Really?
The problem is people don't take water. It's not the calcium doing it. In fact, studies that correlate all these factors for kidney stones, people who take calcium have lower rates of kidney stones.
Oh, wow.
And let me explain. Most kidney stones are calcium oxalate. And when you're dehydrated, the urine is so thick that a stone precipitates. If you are taking calcium and staying hydrated, the calcium binds the oxalate in the gut, and it pulls it out through the intestinal tract. It doesn't even get into the kidneys as much. So the load is transferred to the intestinal tract. The key to all of it, Lorraine, is more water. You don't like water, do you?
Oh, no, doctor, I drink water a lot. In fact,
do you?
Oh, yes. I drink 8 to 10 glasses a day.
Well, then something else is wrong. Have they analyzed your stones? Have they analyzed them?
It was I think it was, okay, I remember now because it was a long time ago, but the doctor, they analyzed it, they said it was from calcium, too much calcium.
Well, that's the calcium
like
oxalate. It's the calcium oxalate. But that thinking has changed.
Okay.
With better information. Let me tell you the things you got to do to prevent these stones and help with all this. And you need vitamin D. Vitamin D helps to prevent stones. Calcium helps to prevent stones. Probiotics help to prevent stones. Dietary fiber prevents stones. citrate from citrus juice, or you can take a citrate dietary supplement or medication. You can prescribe it, citrate, 500 milligrams a day. But if you drink real lemonade, real orange juice, 10 ounces of orange juice a day, or you can take, you see, the problem with the juice is you get all that sugar with juice, right? And we're trying to reduce our sugar intake. So a lot of people elect to take citrate as a pill. And that's okay. See, citrate is not a drug. When you metabolize glucose in your body, you're making citrate, the citric acid cycle. It's in every one of us. It's not a drug. It's not a poison. It's normal in us. So when we increase those levels of citrate in our body, you transfer the burden to the gut, and it minimizes the formation of stones in the urinary tract. Does that make sense to you? Now, Lorraine, this is really important. As the bones go, so does the brain. If we're at risk for osteoporosis, if you're at osteoporosis already, you are on the pathway to cognitive decline and early dementia. Has anybody told you that, Lorraine?
I had a feeling it might have been associated.
You were feeling it, weren't you? You're beginning to realize I'm not as sharp as I used to be.
Well, I take the alpha-halipic acid. I take that every day.
The what? Say it again. Say it again.
Alpha-halipic acid.
Alpha-lipoic acid?
Yes, that's it.
Okay.
Yes.
Okay. Well, there are other things you can do. Ginkgo biloba. You know, I'm glad you called. Everything happens for a reason. It's imperative, ladies, that you understand. If the doctor says you're osteoporotic or your T-score is advanced and you're at risk, you're also at risk for dementia. After menopause, ladies, when the estrogen levels drop and we begin to lose the bone at an accelerated pace, it has a profound effect on our brains, ladies. And so the bone is an early indicator of future dementia risk. So if the bones are weak, the mind's going to become weak. You have been given a warning, Lorraine. Somebody cares a lot about you. You have been warned. Build the bone up, and we help to preserve the brain. I hope I'm making this clear to everybody. Now, Fosamax, that's common. Everybody uses it. When it works at its very best, Lorraine, it will increase your bone mineral density by 3%. Just 3%. It reduces your fracture risk from 3 per 1,000 to 2. 3 to 2. That isn't enough in my book. Nowhere near enough. You know, we have a natural agent that will increase your bone mineral density 1% for every 100 milligrams you take. You know what that agent is? It's magnesium. Magnesium dictates bone mineral density, strength of the bone, not calcium. It's magnesium that sets the pace for the bone. Has anybody told you that? Did you know that?
Well, you know what, doctor? I bought a bottle of magnesium because I had a feeling it was that I was lacking that.
Yes. That's your key element. Yeah. So I want you to take magnesium chelate, at least 500 milligrams a day. I'm going to send you a bottle of it. And I want you to do the magnesium gel topical. And you can put some magnesium into the bath, Epsom salt. Take your calcium. Take your calcium citrate, or however you want to do that. That's fine. I'd rather you take Bone Up. I'll send you some Bone Up. That's good stuff. That stuff really works because it's the exact ratio of minerals found in vertebrate bones, human bones. It's the exact ratio, and it's from purity-tested bovine source. So that shouldn't be a problem for you. The there's some other things that help. Flaxseed oil. It contains substances that promote the hormonal effect. It's no true hormone. It mimics a hormone. Flaxseed. Soy isoflavones. Same thing. It promotes bone strength. Multiple studies have shown this now. This is not news. We know this for quite a while. Vitamin D. Vitamin D is not necessarily thought as essential to prevent osteoporosis. However, you can absorb calcium without it. So vitamin D does play a role. Osteomalacia is vitamin D deficiency, not osteoporosis, but that's a technicality for what we're talking about today. You should be taking probably 4,000 to 6,000 units a day, and the best way to determine that is through blood tests. Get on your citrate or a little orange. Any type of citrus every day will do. Drink those 8 to 10 glasses of water every day. That's very important. B vitamins are important in the prevention of kidney stones. B vitamins. Calcium does not. Calcium takers have lower rates of kidney stones. Isn't that amazing? Just the complete opposite. And there are multiple studies that show this today. Are we communicating, dear? Because I want you to do well with this, because
Yes.
we got you before the big problem. Fish oil.
God, yes.
Fish oil is important for brain and bone protection. Ginkgo biloba is very important. Every year they release a study that's designed to fail on ginkgo biloba. Study shows it doesn't help prevent dementia. Why would they do that? Because they want to sell their drugs. I'm just being frank with you. The studies that are designed appropriately consistently show 240 milligrams of a ginkgo biloba of the specialized extract taken daily. It does. It helps to prevent dementia, and it does it very effectively with virtually no side effects. Virtually. You know, you get into all the details, there are some things that can happen, but for common purposes, it's a carefree herb, and you can take it. So, Lorraine, your care package is coming. I'm glad we talked. We're going to help you today. We have a break coming up. Your call's next. We'll be right back. Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
So what can we do to get back in balance? We can eat a healthy diet.
And most of us need to supplement with omega-3 rich fish oil. Fish oil contains omega-3s with DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan and boost omega-3 to get back in balance.
To help you do that, BioInnovations offers two products, the Fish Oil Complex and Omega 369, both formulated for your health and well-being. So how do you choose? For highest levels of DHA and EPA, choose the Fish Oil Complex. For a balanced formula, choose the 369. Give us a call at 888-442-1828 or go online at bioinnovations.net. Check out the AutoShip program for additional savings. I'm Cindy Becker, and this is Your Health at a Glance. Did you know the typical baby born in America today has over 200 foreign chemicals in their bloodstream? The world is a polluted place, but just how polluted may come as a surprise. Health experts report that pollution plays a major role in the development of ADHD, obesity, cardiovascular disease, Parkinson's disease, ALS, and a wide variety of cancers, including prostate and breast cancer. There are safe and simple steps you can take to lower your exposure to chemicals. Eat an organic, pesticide-free diet whenever possible. Be careful with the home use of chemicals. Don't consume fish that may be contaminated with mercury. Have your water supply tested for purity and add houseplants to lower indoor pollution levels. By taking a few basic steps, we can protect ourselves from disease-causing pollution. For Your Health at a Glance, I'm Cindy Becker.
For centuries, the herb astragalus has been a staple of traditional Chinese medicine. It's used to create a strong shield, protecting the immune system.
Astragalus is also used to support healthy heart and lung function.
There's even more. Astragalus helps to calm total body inflammation, a common cause of pain and chronic illness.
All of that without the use of medication.
That's right. Support your health the way nature intended with astragalus root.
BioInnovations brings you Dr. Becker's Bionutrients Astragalus Root Extract. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-1828 or order online at bioinnovations.net and see what astragalus can do for your health. That number once again is 888-442-1828. Call today. We're back, everybody, taking your calls the entire hour today. So if you haven't called before, there's still time. Pick up that phone, dial the number. We want to talk to you. Well, let's go to New Jersey now and welcome Bonnie to the show. Hi there, Bonnie.
Hi, how are you?
Pretty good. How are you, Bonnie?
I'm not well at all. I need your help.
I will do my best. Tell me, what's on your mind?
I'm having a problem with my vitamin D. My vitamin D level is only 25. My whole body hurts. But every time I go to take it, my heart goes out of rhythm and I have panic attacks. And
Really?
I'm not the only one it's happening to. It's happening to my daughter, my fiance, my son-in-law.
Bonnie, what type of vitamin D are you taking? Do you know, is it vitamin D3, D2?
Yes, D3.
D3. How much do you take?
1,000.
And your heart begins to race because of, really?
Yes,
Vitamin D? I've never heard of that happening to anyone.
I know. My doctors tell me the same thing. I Googled it, and there's thousands of people that it's
Thousands?
happened to. Yeah.
Tell me more about it. You know more about it than I do. I'm learning today. Tell me about it.
Well, it makes your heart. I have a problem with AFib in the first place. I just had an ablation done, and but even now, after they did it, I still have this problem. My son-in-law can't take it, and he's from India. He's like, it's just different nationalities. And when I take it, like an hour later, I get like my blood's rushing, and my heart starts pounding. And
Bonnie, are you taking iodine?
No.
No iodine. Could you possibly have hyperthyroidism?
I have nodules on my thyroid.
No, there's your problem. It's not the vitamin D. You have hyperthyroidism, and the vitamin D makes you more susceptible to the hyperthyroidism. One of the leading symptoms of hyperthyroidism is atrial fibrillation. You have hyperthyroidism. That's your problem. It's not vitamin D toxicity. I promise you. I promise you.
Yeah, they said that they were watching them to see.
Well, time to watch is over. Let's do something about it. You need to see an endocrinologist. You need to see an Will you do that for me, please, dear? Will you, please?
That's who I've been going to. And
well, then go to a different one. Go to a different one and get a second opinion.
Could that be the reason why I'm overweight and can't eat? I hardly eat, and I'm so heavy.
It's called myxedema. It's not fat. It's fluid retention. It's a celluloid type of accumulation of fluid and a fibrous type material in between the cells. It's called myxedema, and it can be responsible for 40, even 50 pounds of weight gain. It's not fat. It's myxedema. When you push on your shin, does it make a dent?
Yes.
Yeah, that's what it is. Bonnie, I think we're making progress with you. You're in New Jersey. So. They have some of the best medical centers in the world within 50 miles of you.
Would that cause my stomach to blow up real big?
Absolutely. I'm afraid it's everything. It's everything. Because every cell in the human body depends on thyroid, and you're getting too much. These nodules are active. They're making too much thyroid hormone. You know, some people are very sensitive, and others can endure a lot. It's just, and the person who is sensitive to one thing is not sensitive to another. So just because the last 10 people with your thyroid levels didn't feel too bad, doesn't mean you shouldn't feel bad. We're all unique. Bonnie, this is the problem, please. I've got to connect with you. And folks, it's imperative. I know we go to doctors and we like them, and maybe they have a pleasing personality, but if we're not making progress, get another opinion. Any doctor who is offended by you getting a second opinion should be fired. If they're so arrogant and pompous in their attitudes that they can never be reproached, because believe me, we all make mistakes, we all miss things, and isn't the goal to help the patient get well? And I will take any help I can get from any type of expert anytime. If you want to look over my shoulder and help me, welcome it. I welcome it. Can we get another opinion? Do you have some help? Do you have somebody with you, somebody close, somebody that cares for you, that can help take you here and there? Because one of the symptoms of hyperthyroidism is mental confusion. I don't know what to do. I'm upset. I can't, this doesn't make sense to me. You follow me, dear? Somebody needs to help you. Is that possible? Is there somebody there to help you?
Yeah, there is. This has been going on since I'm 20 years old. I can't find any good
Well, you're so used to it, you don't know, you can't tell when you're sick now. It's that far along. Will you make me a promise that you're going to get a second opinion on this thyroid condition and take care of it?
Sure will.
I don't think it's the vitamin D. I don't have proof of it, but if you were in my clinic when I was practicing, this is exactly what I'd do. And I'd get you well. I'd get you well. But it's going to take some effort. So before I hang the phone up, dear, I have to know that you're going to go get another opinion. Will you do that? Okay.
Will.
Good.
I will. And
do you have any other questions? Time is short. I'll help you in any way I can.
yes, after my ablation, my heart ablation I had done, I got ischemia of the brain.
Yes.
Is there any, I know that's really bad, is there anything to help that or no?
Well, you fix the thyroid, then we'll talk. I don't want to put anything on board with you to confuse the issues. Nothing. You've got to go in just as you are and get this straightened out, okay? It's important. All right. We have a break, folks. We'll be back in a minute. Have you heard about the health-promoting power of medicinal mushrooms? These remarkable mushrooms include maitake, shiitake, reishi, and ABM. The medicinal mushrooms contain beta-glucans, compounds that promote healthy immune function while helping to coordinate multiple body systems.
BioInnovations brings you Dr. Becker's Bionutrients Mushroom Complex with maitake, shiitake, reishi, and ABM in one convenient product.
Our mushroom complex features the safest and most powerful medicinal mushrooms available, providing natural support for a variety of health conditions.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-1828 or order online at bioinnovations.net. Be sure to ask about the AutoShip program for additional savings.
For many of us, the days pass on by. Whether it's living for the weekend, waiting till the kids come home, or waiting for whatever is next, don't waste your life waiting on tomorrow when there is still today. Benjamin Franklin said, "Do you love life? Then do not squander time, for that's the stuff life is made of." The Lord did not give us today to sit and wait on tomorrow. What we do today shapes our tomorrows. As David wrote in Psalm 90:12, "Teach us to number our days, that we may gain a heart of wisdom."
Different people have different vitamin and mineral needs. That's why Dr. Becker's Bionutrients multiple vitamin and mineral powders come in 4 different blends.
That's right. When it comes to vitamins, no one formula is right for everyone. For those who don't get enough vegetables in their diet, there's the Organic Green Blend with 3 servings of vegetables in every tablespoon.
And for those looking for a boost of fruit and berry phytonutrients, there's the Berry Blend with 3 servings of fruit in every tablespoon.
And don't forget the Active Adult Blend with extra B vitamins, calcium, and added cofactors like ginkgo and CoQ10.
Plus, we've designed a multiple for those with allergies called the Low Allergy Rice Blend.
Whatever your unique needs are, BioNutrients has a multiple vitamin that's just right for you. Give us a call at 888-442-1828 or order online at bioinnovations.net. We're back. Let's go to Michigan now and welcome Ken to the show. Hi, Ken.
Hello,
Hi.
Ken. How are you doing, Ken?
Oh, we're doing okay.
Good.
Pretty good.
Good, good. What's on your mind, brother?
I went and had an annual physical, and they took a chest X-ray and said 3 of my lymph nodes in my abdomen are enlarged.
Well, wait a minute. They did a chest x-ray and they saw abdominal lymph nodes, or in the
Yeah.
chest there were lymph nodes?
In the chest area.
Okay.
And they're 2 and 3 centimeters, and they did a CT scan on it. Now I've got, I think, up to 3 of them.
Okay. Ken, how do you feel?
I feel pretty good.
Are you a smoker?
No, not at all. I own a health club. I work out all the time, eat right, take your products and everything else.
Uh-huh.
I'm taking the noni juice, and I don't know if I need to take something else.
Do you have any lymph nodes that in a location where you can feel them, like at the base of your neck, in your armpits, your groin, anywhere else?
No, none of those are enlarged or feel any sensitive or anything. They're all in my rib. They're all under my rib cage. I'm gonna have to go. I'm seeing a surgeon tomorrow, a thoracic surgeon.
Yes. Well, let me ask you a few questions. Maybe we can give you some peace of mind. Maybe we can give you a sense of need to see the surgeon. We'll just have to follow it, take it where it leads. Do you have any weight loss, Ken?
No, not at all.
No weight loss. Do you have what's called asthenia? It's a combination of I don't feel right and I'm tired. Fatigue.
No, I don't have any of that. No.
Well, so far so good. Did they do a blood test to see if there's any anemia?
Yeah, I went through my annual physical blood test. Everything was good on there except my cholesterol was a little high.
Well, that's a good sign. That's a good sign, because if you have cancer, cholesterol drops dramatically. I mean, it's not proof. It's not proof, but it's a good sign. I'm encouraged. So there's no weight loss, no blood in the stool, no skin lesions that are angry, you know, like a melanoma growing, you know, nothing like that. Do you have any fever? Have you noticed, oh, I've got a fever going, I don't know why?
No symptoms of any kind.
You're not a smoker?
No.
How old are you?
57.
57. You have good vim and vigor?
I do. I work out. I can run 3 miles. I go out and run 3 miles all the time and lift weights in the club.
Did you ever have bronchitis or pneumonia as a younger person?
No, like everybody else, probably I have.
Well, no, that's important because with pneumonia and more severe bronchitis, you can make scars in your lung and the lymph nodes, and they look like they're enlarged, or it looks like there's a tumor there, but they're not really. It's not. It's just a scarred. It's a scarred lymph node. Anything like that in your history?
No, nothing like that at all.
Asthma as a kid. Asthma as a kid.
You know, I had a CT scan a few years ago, and that came. They didn't say anything about any lymph nodes showing up on that a few years ago.
All right. Well, you know, you don't have any of the other signs of a tumor, cancer, lymphoma, but you cannot ignore these. You know that, right? You've got to go in and get it checked. They need to get a piece of one of those lymph nodes. These are called the hilar lymph nodes. It's that mediastinum, the middle of the chest, right behind the breastbone, the sternum, right behind it. That's where they're finding them, correct?
Right.
And you're not a smoker?
No, I have never smoked my whole life. I've been a Christian. I follow godly principles as much as I can.
Now, Ken, do not confuse illness with a loss of your faith. We're all human. We all suffer, and we all have these terrible things happen to us eventually in life. It doesn't mean you're a bad person. You know that, Ken. You know that in your heart. And Jesus Christ is here with you to help you through this, not to persecute you for your failures, because we all fail. We all do that. So I want to get your head in the right place and give you the strength to go through the process. You know, this is very much like what I went through with my lymphoma. That's what I found on a chest x-ray was, uh-oh, the lymph nodes are big. Here it comes. So I hope that's not what they find on you, but it's a possibility. It's a possibility. I had other symptoms. You don't have this. Isn't this interesting? No other symptoms. Maybe we caught this early. Maybe it's just a scar. Will you let us know, Ken?
Yeah, I'll let you know. I don't have any symptoms that I'm aware of. No pain. Nothing else seems to be out of whack.
No cough. No
cough.
Not bringing up any phlegm or anything like that.
Night sweats.
How about night sweats?
You know, I do wake up sweating in the night sometimes.
Yeah, but are you soaking the sheets? That's the night sweats.
No, I'll have to change my shirt sometimes, but there's more stress related than anything, I think.
Yeah, you know, in Michigan, you have the heat on, it gets warm, and, you know, not necessarily night sweats, but it could be. Well, there's nothing else to do now, Ken, except go through the process, find out for sure. And the diagnosis of all types of cancer, it's still a tissue diagnosis. They need to get a little piece of that mass, whatever it is, and look at it under a microscope. Then they'll do laboratory and chemical analysis and further to get subtypes if it is a tumor. But Ken, I want you to know we're all praying for you here, and all our viewers, everybody. I just know everybody watching is sending up a prayer right now. So think positive thoughts. You know, people who beat cancer, they have a can-do attitude. You got to keep the attitude up. I want to send you Foundations for Healing. I want to send you a basic program to support your nutrition so that no matter what they tell you, your nutrition will be set and you'll be in good shape to go with it. I hope that helps you, Ken. Any parting thoughts before we go to our break?
I take vitamin D. You know, I've raised that. My vitamin D level was 31.
Get it up to 60 to 70 nanograms.
Yeah, that's what I'm trying to get it up. I'm taking 6,000.
What do you weigh, Ken? What do you weigh?
About 180 pounds.
Okay, that's 7,000 a day will get you there. 7,000 a day. And you know, you have a lot of very good signs. Very good signs. You don't show the typical characteristic symptoms of a tumor going on, but that's not enough. We got to know more. We got to know the truth. Okay, buddy?
You think the Noonie juice would help? I'm taking your
Absolutely
Noonie juice.
Take it. Absolutely.
How much
I'm going to send you curcumin, noni, grapeseed extract, probiotics, good multiple vitamin. I'm going to send you what you need, but you go in there and get a piece of that, and let's know for sure what's going on, all right? And please let us know. You're on our prayer list now. We want to know. Okay, buddy? We have a break. We'll be back. Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why BioInnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
So call 888-442-1828 or go online at bioinnovations.net to place your order. Ask about the AutoShip program for additional savings.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
I'm Cindy Becker for Your Health at a Glance. We all have said, I need to get some exercise, but how many of us put on our walking shoes and go? Learning a little more about the health benefits of exercise may help you get motivated to lace up those walking shoes. Exercise helps to control our appetite and weight. It maintains strong muscles. It promotes the release of endorphins that counter depression while helping us feel good about our lives. Exercise helps to lower blood glucose, promotes a strong circulatory system, and controls cholesterol. Exercise even helps us get a good night's sleep. Recent research finds dog owners who regularly walk their pet are 34% more likely to achieve fitness goals. You can get all of these health benefits by walking 30 minutes 4 times a week, just 30 minutes a day. Start today, and you'll start to get all those benefits. For Your Health at a Glance, I'm Cindy Becker.
Have you heard of Cordyceps sinensis, the medicinal mushroom that supports metabolic processes for stimulant-free energy? This remarkable mushroom also supports the immune and respiratory systems, as well as the heart and lungs.
BioInnovations brings you Dr. Becker's Bionutrients, Cordyceps sinensis.
Medicinal mushrooms contain beta-glucans, compounds that promote healthy immune function while helping to coordinate multiple body systems. And Cordyceps sinensis is among the safest and most powerful medicinal mushrooms available today, making it your choice for stimulant-free natural energy.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-1828. That's 888-442-1828. Or order online at bioinnovations.net. Be sure to ask about the AutoShip program for additional savings. Your Health is brought to you by BioInnovations, trusted products for your health and well-being.
We're back, everybody. Let's go to Washington now and welcome Deborah. Hi there, Deborah.
Well, hello, and I might be a little emotional. God bless both of you and all the knowledge that you are giving all of us.
Well, thank you very much, Deborah. Thank you.
Thank you. Well, Dr. Becker, in 2001, I had a near-fatal horse accident.
Accident? Oh, my, okay.
A long time to get well.
All right.
And I've struggled with obstructions. They took 3.5 feet of my small intestines out. And it seems like I can eat all the horrible foods, and anytime I try and eat healthy, I get sick.
So did they tell you, have you found that a low-residue diet, low-fiber diet is the best for you?
They haven't told me anything other than they don't know why I keep having these obstructions, other than maybe there's a kink somewhere. And 2 years ago, they reopened me back up because I was also struggling with anemia, and they thought that might be related to the accident. But they have never put me on any type of diet of any kind.
Well, okay, Deborah, this is something I know a little about. When you lose part of your intestinal tract and you're under trauma like this, and the surgeon has to go in and cut and take things out, it leads to scarring. And when the abdominal cavity scars, it's not like a scar on your finger or your arm. It creates a cobweb-like effect. It's called abdominal adhesions, and it's a scar tissue process. And so that cobweb will intertwine with your intestinal tract, and it can cause obstructions. It can cause narrowing of the gut lumen, or it can actually block it completely. Now, I don't think you're completely obstructed, or have you had that in the past? Have you had to go back in?
I hospitalized like 6 times for it.
Oh, okay. Well, then you want to absolutely do everything you can short of surgery, because anytime they have to go back in and cut more, you're going to make more adhesions. And it makes it worse, ultimately. The only reason to go in again is complete obstruction. You have to find a way to live with this. A low-residue diet. This means it's not a high-content, insoluble fiber diet. You can have some soluble fiber, like pectin. You know the pectin in jam? That's a soft, oozy type of fiber that will help you. But generally, your diet is low in fiber. This makes it a problem. It's hard to pass. So get yourself some Colace or Surfact at the pharmacy. It's an oil you do not digest. It makes the stool slippery. It helps it pass through. But you need to be on a good multiple vitamin and mineral, because when you lose feet in your intestinal tract, you lose the ability to absorb. And even a foot or two can decrease your ability to absorb magnesium, B12, calcium, and on and on. So I want to send you vitamin D, a good multiple vitamin powder. It's high potency, and some B12 sublingual. Get your nutrient level up. I think you're going to feel better. Low residue diet with Surfact or Colace, an oil you don't digest, and it helps to pass through so you have less discomfort. It's the best approach for this. It does help. Nothing will cure you completely, but we can help with the symptoms. We have considerable experience with this. It's a real challenge to live with, but it can be done. Life can return and have good days again. Well, interesting program today. A lot of very special calls. You are in our thoughts and prayers. Everyone who calls this program, you're part of our family. We'll see you again tomorrow. Bye-bye, everybody.
Thanks, everyone. We'll see you tomorrow. Bye-bye.
Is your closet cramped and cluttered? Well, now there's Space Triangles, the clever new hanging device that fits over any hanger to save you closet space in seconds. And now may be your last chance to get them for a low price. Now you can vertically hang multiple items, guaranteeing that you'll have up to 70% more space in your closet. Your closet can go from messy to marvelous in no time with ease. The ingenious slip-over design secures the hangers vertically. It snugly fits all types of hangers to save you space. Order Order now to get an 18-piece set of space triangles for just $9.99. But wait, due to rising costs and supply chain shortages, this may be your last chance to get space triangles at this low price. There is a strict limit of 1 closet pack per order while supplies last. Once they're gone forever. Order now.
Call 1-800-592-7531. Call or visit spacetriangles.com. So call 1-800-592-7531 now.
Golfers, who out there wants to hit their longest drives ever? Jack Ham, world's longest driver and golf leading product innovator, has designed the new future of drivers. Check out Jack's new Hammer Turbo Air, the only driver powered by